Hello, how are we? Thanks, David and Louise. Oh, and now we got more people joining for being ready. Just going to give it a few more minutes. If you can't hear me or anything, then just let me know, and I can start playing around with some of the audio settings. Just having a look now. So more participants are coming in. That's great. Audio seems to be coming through. All right, excellent. So I also have the chat screen up, so if at any time you want to say anything, say hello or have any questions, just pop it in there. Just a bit of a heads up. So today I'm expecting the webinar to go for approximately 40 minutes. We'll do some questions at the end as well. By all means, it's Friday, we all have places to be, so if you can't make it through the whole webinar, that's okay. This whole thing will be recorded anyway. Well, it's almost on 1:30. I'll give it a few minutes past 1:30, just so people can make sure that they've clicked on Zoom, actually installed it. Hi, Rochelle. I hope you're well. Thanks for joining me, or all of us, I should say, today. Today it's a pretty interesting topic. It's one that just continues to develop. I was actually still working on these slides today because every time I had finished the slides, something else or some new kind of news would pop up. So it's one of those things that all of us really have to keep on top of and really find out the latest news to really understand what's going on. I'd also recommend grabbing a coffee if you still have time to go grab one, because yeah, we will really be covering a lot. So just having a look at the list now, there's a lot of new names, which is great, welcome, and a lot of familiar names as well. So nice to see you all again. So far on schedule. Again, if you see that there's any kind of video or audio issues, just let me know. I'd certainly recommend having a look on your end first, just making sure you've got a good internet connection, that your volume is up. If the speakers on your laptop or computer aren't that good, recommend using a headset. Even having a look at the list now of people who are joining us currently, I guess I'm thinking about the types of industry that you work in and just reflecting on what the COVID actually means to your industry. We really haven't seen any part of our current lives not impacted in some way, shape or form. It looks like I was a little bit late yesterday to get some food. I mean, I wasn't stocking up or anything, but I noticed that shelves for baked beans, pastas, a whole lot of things are really starting to empty. So I think everyone's pretty wary at this point of what COVID means and what it might bring for the future. I've still got some participants coming in now. It's bang on 1:30, so yep, so we've got a bit of an increase. Just wait a little bit longer and then we'll begin. So the air conditioner in here is starting to make a few sounds. If you can hear it in the background, let me know, and I'll adjust it. Now, for now, I'm just looking at my right side. Don't worry, I'll be focusing more on looking at you while I present. It's just these days, when it comes to conferencing, you know how it is. It's just monitor after monitor. There's a lot of things to keep tabs on. So what I'll do is I obviously don't want to make any of you wait. So I'll give it another 2 minutes exactly, and then we'll begin the webinar. That door. So I just want to do a quick test now. If someone could just use the raise hand feature, or maybe just type in the chat to let me know that you can hear me. I haven't seen any, oh, there, perfect. So it looks like audio is coming through. Great, thanks guys for that. Yep. Okay, excellent. So what we're going to do is actually get started. So I'm going to start by sharing my screen with the PowerPoint slides. You should see that on your screen now. Let's see if I can just drag my face there quickly. No, let's just leave it like that. So today, obviously, the topic is the current SARS coronavirus 2 and the resulting disease, which is COVID-19. So today we're going to have a bit of a look into it. There's going to be some biology involved, but we're also going to talk about workplace measures. Okay, so just quickly a little bit about myself. So hi, my name is Julian. I completed my Bachelor of Environmental Science at Deakin University. So one of the things I was looking at for my honours was remote waste management, and particularly how it was maintained in a changing workforce, and particularly with the kind of biosecurity controls they have there. I'm currently an occupational hygienist at Anitech. I look into air quality in relation to organic compounds, heavy materials, pretty much any kind of airborne contaminant. I look into workplace exposure for noise and hearing conservation, and I'm also involved in workplace ergonomics. Prior to that, I was working with Anitech again, doing management systems, so predominantly looking at management, risk management, and then quality, safety, and environment systems implementation. So just a bit of a disclaimer before we get into it. Keep in mind that this is a rapidly changing event. It's impacting pretty much every aspect of human activity at this point. We all have different ways of collecting and interpreting information. So what I'm saying, it's a lot of it, while I've done my research, I'm not saying that it's, you know, it's indeed fact. Current political responses will not necessarily be covered. We'll talk a bit about the status, but when it comes into the suitability of the response, we won't talk too much about that. And then advice by suitably qualified medical professionals and organisations always takes precedence. So this webinar definitely isn't medical advice. I wouldn't consider it as comprehensive coverage as well, given the time limits that we have. And again, keep in mind that new information is coming to light essentially on a daily or at this point hourly basis. So let's get a bit of information on what the basics are of contagious diseases, predominantly viral. We will be including a bit of biology. We'll be looking at what we've learned from past outbreaks, because history can teach us some valuable lessons. And then we'll delve more into COVID-19, so the discussion on the transmission, the health impacts, and the kind of controls you can implement, particularly within a workplace setting. So just having a look from the World Health Organization situation report, this is released daily. You can access this on their website. This is for the 12th of March, and we can see that globally, we're definitely seeing quite a bit of an impact. A lot of information has been coming out in regards to Italy and France. Just having a look at the bottom of the screen, we can see that that kind of area in Europe has really started to increase at this point. Again, from the same situation report, just we're not looking at every country because the list is quite extensive. Currently, Australia is sitting at 122 confirmed cases. 10 of those are new. The fatality rate has been 3 currently. I think one of the areas that has now been included, which is part of Australia, but Tasmania as well has actually seen the coronavirus. So let's just start by looking at some of the terminology. When we talk about epidemic and pandemic, sometimes we use it interchangeably, but there actually is a difference. So according to the Centers for Disease Control and Prevention, an epidemic is a sudden increase in the number of cases of a disease. It's more typically expected in a population for a specific area. A pandemic, that's when we see a spread over several countries or continents, and we see a large number of people being impacted. So the last pandemic was actually announced by the World Health Organization in 2009 for H1N1, also known as the swine flu. Infectious disease, so this is any kind of illness caused by germs, whether it's bacterial, viral, or a fungus, which can enter the body and cause an infection. Contagious, that is when we see an infectious disease that can spread from one person to another. So it comes as to no surprise that I've got this little statement that COVID-19 is an infectious disease which is contagious. We all know that. And the situation has now officially been called a pandemic by the World Health Organization as of yesterday. That being said, Australia had already started rolling out its pandemic response plan. Current disruptions, the list is growing. We've seen the global markets continue to drop. Just today, they were discussing if the GP is going to go ahead. Potentially it might be, but without spectators. And then the supermarket shelves, anyone who's been shopping lately, of course, has seen that the supermarket shelves don't look like they usually do. So there is a bit of activity going around in those areas. Tourism and education in Australia is estimated to be impacted in particular. Gatherings and large events are likely to continue to be postponed, modified, or cancelled. So there's the discussion of the GP. On Monday is the Download Festival, which is a very popular heavy metal festival that's now just been cancelled. And the government has announced a $17.6 billion stimulus package in light of the coronavirus outbreak. Incentives for retaining employees, we're also seeing discussions around that, particularly for apprentices. So before I go any further, I really want to just clarify the difference between a bacteria and a virus. Often we say things like kill a virus. Technically, you can't kill a virus because it's not alive, but we use it for a lack of a better term. So on the left-hand side, we've got E. coli. This is indeed a living organism. It's able to metabolize, so it can ingest energy around it and it can reproduce. On the right-hand side, we've got the SARS coronavirus 2. This has been taken with an electron microscope. It's not alive. It injects genetic material into living cells. From there, it then uses the cell's own machinery for replication. So this is where we're going to talk a little bit about genetic material quickly. Essentially, a virus is non-living. It's a capsule that contains genetic material inside of it. Some viruses will contain DNA, deoxyribonucleic acid. Some will consist of RNA, ribonucleic acid. Now, when we have viruses that consist of DNA, they replicate in a very predictable manner. So some of these examples are chickenpox, smallpox, and herpes. So we know that chickenpox, once you get it, your immune system, it evokes a response and our antibodies then are able to remove it. Smallpox has now essentially been wiped out. When it comes to RNA viruses, that's when we have an issue. So we've got Zika, yellow fever, and influenza. And of course, coronavirus is a RNA type, which means it can be unpredictable. So just to describe that, you can almost think of viral DNA replication being like hitting copy and paste on your keyboard. You type hi, you just do copy paste, you're going to get the same message every time. RNA, it's more like handwriting, so you'll see the message can change in time. DNA being predictable means our immune system can recognize an infected cell and control it, provided we've got a good immune response or have received a vaccine to evoke immune response. RNA can change, so that means our immune system may not recognize the infected cell after some time. So an example of the application of vaccines, if it's something that contains DNA, generally the vaccine will work again and again. When it comes to an RNA type of virus, the vaccine may initially work. However, as it begins to mutate, essentially, you can end up with a vaccine that no longer works for a different strain of the same virus. So SARS coronavirus 2, cause of COVID-19, it contains RNA, therefore we consider it as unstable. Treatment drugs, they do need to keep up with mutations of the virus, otherwise by the time the treatment comes out, the virus could have already mutated. RNA viruses can sometimes jump between species easier, so that's why we've seen it with the swine flu, and we've also seen this with the case of SARS coronavirus 2, where it's believed to have started in a wet market. So these kinds of viruses can cause pneumonia, which severely impacts our ability to intake oxygen while also removing the carbon dioxide from our system. Just a bit of a description of pneumonia. So the current SARS coronaviruses that cause quite a bit of issues with pneumonia is we saw the SARS-CoV in 2009. There's also the Middle Eastern Respiratory Syndrome, which is current. And then, of course, we've got the current SARS coronavirus 2. What happens when we have pneumonia is the tiny air sacs in our lungs begin to fill with pus and fluids. Now, pneumonia can be caused by a bacteria, virus, or fungi. In this case, obviously, that is a bacteria. So just having a look at this diagram here. So this is a zoom in of an air sac, and we really need the epithelial cells around it. Here, I'll get my pen. We really want to be able to keep these epithelial cells around it in a nice, healthy condition. And the reason for this is because, well, it plays a very important part in how we remove carbon dioxide and take in oxygen to replenish our blood. So one of the questions is, why is the virus targeting the cells in our respiratory system only? Currently, what is hypothesized is that the protein spike on the virus itself is able to bind with the receptors of the epithelial cells within our respiratory system. So you can really think of this as a key and lock kind of analogy, where the virus holds a key and it is able to unlock these particular cells. So one of the questions that they're currently looking at is there a drug or potential drug which can block this key? So then if that was potential, then it wouldn't actually bind to the cell. Colds and other common viruses, they do tend to only impact the upper respiratory tract, and that's why often when you have a cold, it's almost like you feel very congested, but you may not develop a cough. What we're seeing with SARS coronavirus 2 is that we're also seeing the lower respiratory tract being impacted. So again, they're looking into what kinds of cells is this virus able to bind to, and the epithelial cells within our respiratory system seems to really be its way into our body. So just another graphic of this. So this is from the H1N1, also known as swine flu or influenza A. Once the virus binds with or gets into rather, our lung epithelial cells, you start seeing the destruction of those cells. And then of course, we start getting issues in being able to remove carbon dioxide and take in oxygen. Okay, so that's the majority of the biological stuff done with. So why is coronavirus, or COVID-19 rather, such a threat? A lot of people are saying it's just the flu. Well, it really isn't. First of all, we know a lot more about influenza than we do of coronaviruses. We've been dealing with influenza for over 100 years. Transmission does appear to be faster than influenza. So this is why it's currently being called a super spreader. Overwhelmed healthcare systems means that response times can be lower. And of course, if the response times are lower, then there's more ability for the virus to spread. And as we could all understand, that a global rollout of a drug to combat this disease would be no easy task. So are we heading into the unknown? Let's have a bit of a look into what's happened in the past. I'm just going to take two quick examples. One of them is the 1918 influenza pandemic. So this occurred around World War I and saw approximately 50 million deaths worldwide. And this was, the world wasn't prepared for this. It was definitely on a global scale. And we can see on the left-hand side, we've got these nurses preparing to treat flu patients. They had no idea about how this was actually contracted, transmitted. They're covering their mouths, their noses are exposed. We know that the flu definitely is, you can contract it through your mucous membranes, such as your nose. And then we've got a New York street sweeper here who's actually being put to work to do additional cleaning. So again, we were seeing people already through their occupation having an elevated risk of contracting the flu. The 1916 polio outbreak was, well, that was essentially an epidemic. So this was localized within the USA predominantly. It targeted younger children and invaded the nervous system. So it didn't infect the lungs, however, it caused paralysis of them. So that's why they ended up making, you may have heard of the iron lung, which was that contraption that helped people breathe once they received that paralysis. In fact, the 32nd president of the United States contracted polio at age 39. So it was generally targeted to young children, but that's not to say that other people or older people couldn't get it either. So from then, information is vital. During World War I, countries, they didn't actually want to appear compromised. So the initial responses to the flu were considered as delayed and downplayed. Of course, you're a country at war. You don't want to, oh, sorry, I'm just seeing this. Can you turn the video off? It's blocking the picture. Sorry, I've just seen that. I thought I had switched it off. Here, I can do it on the top here. Stop video. Perfect. There we go. Sorry about that. Okay, let's get the slides back up. Just 2 seconds. Yep, that's the one I wanted. Okay. Sorry about that. I should have read that a while back. Okay, so then, yeah, look, information was pretty much being hidden, where information now is essentially everywhere. This is a good and a bad thing, because we can leverage good advice. However, we need to remember that we need to filter out misinformation. So like anyone, we've all been on Facebook, and we've essentially seen the kinds of information that's shared, and you really got to ask, where does this information come from? And, you know, has it been peer reviewed? Is there any citations? It's, you do really have to be careful. Global travel, commerce and conflict allowed the spread of viruses which could otherwise have been isolated to regions. Demographics of vulnerable people also impacts the spread. Now that is definitely the case now. So we see that we have a much larger population. We are truly a global community, and global cooperation is vital. Been studying the topic too much. Viruses were less understood then. I mean, even due to their size, they couldn't actually see them until around the 1930s with an electron microscope. Non-clinical diagnosis now can be still quite difficult. So you can think about when you go to the doctors and you may receive antibiotics if you're suffering a cold. That's going to do absolutely nothing because cold is a viral infection. It's very hard to determine these just through symptoms. As we saw with pneumonia, it can be bacterial, viral, or fungal. And we are largely stuck with reactive measures to emerging diseases, because it's not until we start seeing some trends that we can understand that there may be an issue going on. Hygiene standards were certainly much lower. The importance of them weren't necessarily that well understood. Nowadays, there really is no excuse. We do know the importance of hygiene in the reduction of disease contraction and transmission. So I head back to the initial question, which is, are we heading into the unknown? I actually think the more relevant question is, are you heading into the unknown? So this actually empowers us as individuals or with colleagues or as a community to really take some kind of action. One of the first questions is, do you have a good understanding of hygiene practices? We don't like being told, wash your hands with soap and water, but it is actually a reminder that we do need to have, and just because you wash your hands with soap and water doesn't mean you're doing it correctly, so we'll talk about that a little bit later. Based on your personal health and age, are you at an elevated risk? If you think you may have COVID-19, what will your next steps actually be? And I mean this from a step-by-step standpoint. What does self-isolation even mean? After all, you do live with other people. So if you are going to stay home, is your partner also going to stay home? Are you going to, basically live in another room? Are you still going to eat together? Do your cooking, wash together? You've got to think about, I guess, what your definition of self-isolation means. Do you have a vacation or some kind of event booked that might be impacted? At this point, I'd be surprised if any kind of mass gathering events go ahead. And then will the supply of your medications be impacted as well? Because these days, it's pretty common for most of us to be on one kind of script at least. So you want to consider, okay, well, what supplies do you have and how long will they actually last you? Take extra precaution if there's a certain number of things or one of these that apply to you. So if you do have some kind of chronic medical condition, some form of heart disease, diabetes or lung disease or damage, then you really want to be sure that you take precautions much seriously. Transmission paths. On the right-hand side is MIT's sneeze cam, which gives you a bit of a visualization of just how far a sneeze can actually propagate. This is considered highly contagious, particularly between the spread of human to humans. The distance that they're saying that the spread is most likely to occur is within 6 feet. However, this is from the CDC, the World Health Organization. I believe they're saying 3 feet. Droplets from coughing or sneezing, which land on the mouth, are inhaled by people within the proximity, and that's generally the main form of contraction. Possibly contracted via contaminated surfaces and objects, so we'll have a bit of a discussion about that in particular, because that seems to have a lot of questions around it. It's most likely spread due to symptomatic responses. That comes as no surprise. This is when you're coughing, you're sneezing, and you're creating more of those droplets. Close proximity to infected animals, I think that's less of an issue here in Australia and in most areas outside of China. And its path of entry is via the mucous membrane. So that's your eyes, your nose, and your throat. Symptoms can be between mild and severe. Again, it really depends on your age, if you've got any kind of chronic illnesses. Symptoms generally show up between 2 and 14 days after exposure, and we can see fever, cough, shortness of breath, aches and pains, general feelings of fatigue. This is all information based on what we know about the Middle Eastern respiratory syndrome, because it's been around for longer and we've had more of a chance to study it. So I'm going to direct you to this journal article, which you can access for free. It's called The Persistence of Coronaviruses on Inanimate Surfaces and Their Inactivation with Biocidal Agents. So Again, it really does vary based on the strain and type of surface. So you have to take this all with a grain of salt. But you know, depending on whether it's metal, wood, paper, or plastic, generally the virus was shown to still be active between 24 hours and 9 days. They do degrade or die, for lack of a better term, in quicker in warmer environments. So this is between 29 and 40 degrees Celsius. Lower temperatures of 4 degrees and below sees the preservation increase of up to 28 days. So that's a significant amount. It can be effectively inactivated by surface disinfectant procedures. So we want to see, they recommend over 60% alcohol. This study recommends 62 to 71% ethanol. And you can also use 0.5% hydrogen peroxide or 1.1% sodium hypochlorite. But you do want that to be on the surface for a full minute. Another question that we get is masks. So do they serve a purpose? Look, you can see here on the screen is a picture of myself. I have a beard and I'm currently wearing that mask incorrectly. We do have machines where we can do fit tests to determine if outside contaminants are getting within the mask. As you can see on mine, I've got an overall fit factor of 17. So that's out of 100. So that's definitely a fail for me. They do require the right storage, handling, fitment, and disposal. So you can imagine if you've got some kind of germ on your hand, you're now handling the mask. You might actually touch the inside of the mask and you've now contained that germ within it. So they can also give us that false sense of security. However, I definitely recommend follow any health organization's advice in regards to when they recommend that certain occupations use masks. So one of those is people working in the healthcare sector. I believe they're currently being told to use masks. But just remember, if you're out in public wearing a mask, you're not Superman or woman. We really do rely on standard controls in these kinds of instances. So make sure that you wash your hands with soap and water and ensure your hands are completely dry. I'm actually going to repeat that because I think it's that important. Wash your hands with soap and water. Ensure your hands are completely dry. There isn't much use in washing your hands with soap and water than just drying them off on your shirt or letting them hand dry or not using a hand dryer for long enough or paper towel. You'll end up with a wet surface on your hands, and germs love wet surfaces. So you'll end up pretty much just covering your hands in germs. If soap and water are not available, use alcohol-based hand sanitizers. So CDC are recommending above 60% alcohol. Maintain adequate hygiene in bathroom and kitchen facilities. That really goes for any time of the year, whether there's a viral outbreak or not. Clean your tech gear, keyboards, phones, iPads, all these things that we handle constantly. Try not to shake hands. I think at this point, people generally understand and are more than happy just acknowledging that a handshake isn't that appropriate at this point. Sick employees really shouldn't be at work. We'll cover that a bit more as well when we start looking at the legal implications for workplaces and this disease. If you have a large group of employees or you have a mobile workforce, develop a response plan, something else we're going to have a chat about. If travel cannot be avoided, self-quarantine post-trip. Again, please have a think of what self-quarantine means to you by definition. Utilize working from home. Make sure you have processes in place for that. So on the right-hand side, you can see that you can use a UV oil, which can show the kinds of residues that are left over if you don't wash your hands correctly. And if you think you may have the coronavirus disease, then there is a dedicated hotline. So you can actually, don't have to write it down, you can Google it and you'll find it pretty quickly. So this is just a quick example of my hand that I've washed my hands with soap and water. You can see within the webbing of my hand, I've used a hand dryer. However, I've only used it for 5 seconds. You really want to be putting your hands underneath the hand dryer for at least 40 seconds to make sure they're dry. Paper towel, you generally can dry your hands quicker, and you've also got the benefit of having some kind of friction to remove any contaminants. However, these days, sometimes we just don't get the choice. Depending if you're out at a restaurant or if you're at work, you're pretty much given what you have. So soap, water, make sure they're dry. They're the real key elements there. Also, so some of our habits can kind of go unnoticed. This is a pen that I picked up and I noticed that it had been chewed on. I mean, it's not nice during these times, but I think in general, it's the kinds of things that can spread germs anyway. So please avoid it, and maybe pick better habits too. So check your health websites for regular updates. I've got a list of resources at the end of this because more information is being found out as time goes on. Again, avoid touching your mucous membranes, so your nose, your eyes, and your mouth. When coughing or sneezing, use tissues, or if that's not available, your elbow. Once you've used those tissues, don't put them in your pocket, throw them out. Stay at home if you feel unwell and consider seeking medical attention. And I would say that your first port of call is indeed calling that dedicated hotline and getting their advice. So when it comes to the kinds of controls that you'd be wanting to implement in your workplace, it's really going to depend on your level of risk, or the workplace's level of risk, and also the availability of suitable controls. It goes without saying that you want to provide adequate facilities for employees to maintain good hygiene practices. So this may be hand sanitizers. Again, I'm a real advocate of the basics: soap, water, dry hands. You may want to look at developing an infection control policy, so we can discuss what is involved in one of those later when we have a bit of a Q&A at the end. Advise employees to self-isolate at home for 14 days if they have been to any countries listed on the Department of Health and Human Services as requiring self-quarantine, or if they've been in contact with a confirmed case or cases of SARS coronavirus 2. Legally, so these are some tips provided by WorkSafe Victoria. However, it doesn't matter what state you're in, if you're under harmonised legislation or if you're in another state, it's all going to be very similar. Your obligations to provide and maintain a healthy workplace is the same. So employees must identify whether there is a risk of exposure to the coronavirus at their workplace, need to monitor expert advice as the situation develops, educate employees and keep them up to date on new information, monitor the latest travel advice. Of course, that's more applicable for workplaces with a mobile workforce, and consider whether work activities do put others at risk. So if you've got employees that are having to go to public areas, is this going to be an issue? What kind of risks are they getting exposed to? So with any other workplace hazard, assess the risk, develop appropriate controls, implement the controls, review and revise them as required. Employees, we also, as employees, we need to make sure that what we do in a workplace doesn't put anyone else at harm. And so employees should be raising any concerns with their manager immediately. Of course, you'd much rather them do that over the phone rather than come into work and say it. The employer may ask the employee to seek a medical clearance or work from home during the risk period. If employees are not fit to work due to contracting the virus, again, they should seek medical advice and remain isolated for 14 days. So what should be in some kind of response plan? I call it a germ plan. You can call it a management plan, infectious disease plan, whatever you like. It doesn't necessarily just have to be tailored for the coronavirus. You want to really understand your exposure groups and employee demographics. So are you facing an aging workforce? Have you got a younger workforce? That's obviously going to impact the level of risk in the case of COVID-19. Authority hierarchy, so who's going to do what, when, where, and how. At the end of the day, decisions and very tough decisions may need to be made. So you want to have it really clear who is going to do that. Required resources, particularly human and financial. I think we've all seen our workload change in the current situation due to this. And then response strategies and plan mitigation levels. So an employee comes into work, leaves, you then get a call saying, look, I'm sorry, but it turns out I had coronavirus. What kind of response strategy are you going to have for these? Whether it's an isolated case, whether you start seeing a trend in few employees getting it. Also have your emails drafted and reviewed. You're going to be having to share a lot of information to a lot of people. You want to make sure that whatever you write in there isn't taken the wrong way, or you've got some kind of typos that change the message. So if you have to stop work due to it, or if there's going to be some more working from home arrangements, just make sure whatever your messages are clear and very easy for people to understand. I'd also, I'm sorry to have to do this, but a quick reminder, we are heading into Australia's 2020 flu season. A total of 4 strains have been identified. Every year, the Australian Influenza Vaccine Committee get together, they have a look at global trends and they say, okay, based on this, we expect that Australia is going to be exposed to X, Y, Z strains. So controls you implement now for COVID-19, it'll be useful one way or another, whether you're impacted or not. The key tips and takeaways right now, it really is information overload. Please stick to reliable sources, check updates regularly. There is no substitute for basic hygiene practices. This holds true for bacterial, viral, or fungal germs. So let's just use this as an exercise to kind of really up the hygiene standards in our workplaces. Spread awareness in the workplace, but not panic. You know, if we can implement controls in line with levels of risk and essentially go from there. So I've got this list of reliable resources. Web of Science is always a good one. Peer-reviewed journal articles, Department of Health and Human Services. So we're talking about government organisations or international organisations which deal with global health issues. So look, thank you. That's it from me. What I might do is I'll bring my my face back onto the monitor, and I'll open it up. If anybody would like to ask some questions, then we can go from there. So you can either use there's the Zoom webinar chat functionality, or there's also this a Q&A option. So either or, it doesn't matter. I've got both up, so you can ask through those, and I'll try to answer your questions. Thanks. So I'm just going to get my video back and stop sharing. Excellent. Sorry, I'm just trying to organize this, these screens so I can make sure that if anything is asked, I can see that pop up. So the only thing I'm not opening right now is the Q&A. Oh, there we go. I've got that one open as well. So feel free to use either the question and answer dialogue, or if you like, you can use the webinar chat. We did cover a fair amount of aspects here. So if you want to delve more into the types of workplace controls you could implement, we can discuss that. If you want to have a chat more on the legal side of things, we can have a bit of a discussion. Or if you just want to know more about viruses in particular. I've got a question here. Yep. Am I able to send a copy of the webinar slides once finished? Yes, absolutely. So Tripti has the list of attendees. So what I'll do is I'll make sure that we can get this out. So we're getting a good question here, which is just to clarify mask types that are suitable. Dust masks, no good. So I believe this isn't a question, but a statement. So that's actually a good thing to point out is I think a lot of people are getting their hands on whatever kinds of masks they can and expecting that'll essentially be enough. What we're seeing is even if you have the right type of mask, then if you're not handling it correctly, if you're not wearing it, if you haven't got a proper seal, or if you're touching the insides, then you know, essentially no mask is foolproof, essentially. We've got another question here. So what is the general recommendation if your employee advises that they have COVID-19? do you need to close the facility? That's a very difficult one to answer because it again goes down to the level of risk essentially. So if there is that potential for other employees may have received exposure or there's some kind of contamination in your workplace, what I would recommend is calling the coronavirus hotline and just trying to get some information from them and saying, okay, well, what does this mean for, you know, if I do have an employee with it, what are you currently seeing? So it's again, one of those things, it's really difficult to answer in a very black and white fashion, purely because there's so many variables that are involved. Another question is, do I think that the situation is going to get worse? I think we will continue seeing more of a spread before there is any kind of real noticeable dip. But it depends what your definition of worse is, because let's say we have another X amount of people contract the virus, but their symptoms are mild, then, you know, it's really hard to tell. I think time will tell. Definitely keep up to date with the list of websites, so World Health Organization, Center for Disease and Control, and then the Department of Health and Human Services to understand what their advice is. Definitely, we've had one of my colleagues has just made a note here, which is very important, which is employees should really be making employers aware as soon as they suspect that they might have some kind of viral infection. So what we're seeing at the moment is as a mitigation strategy, and this might help the initial question if in regards to having to close facilities or not. If somebody is getting some kind of even like flu-like symptoms or any kind of like any symptoms that are involved with a viral infection, then what they should be doing is advising the employer as soon as possible, and that they shouldn't be coming at work at this point. Some of us are lucky and we have that ability to work from home, others not. But there is no doubt that we are going to get some kind of, we're already seeing the economic impact at this point. Getting another question here. So this is through the chat. Would it be good to include in a response plan guidance policy regarding coronavirus or other infections? So the way I'm reading this question is, does the response plan have to be purely focused on the coronavirus? Not necessarily. That's why I consider it as a germ control plan. That being said, when you look at the kind of mitigation strategies you want to implement, definitely, as you go more in detail, you want to be more specific towards the combating coronavirus in the workplace. Just getting someone else saying, thank you, very informative. Thank you. I hope you got some value out of this. Will the rains affect the current situation? I'm going to go off what I personally believe in this case, and that is when we see transmission, it's human to human within very short areas, and it's generally from water droplets. So that we cough or sneeze out. That is really going to be the primary cause of receiving this virus. I don't think in regards to rain, it's going to have any kind of impact. I mean, maybe, you know, if someone's touched a table outside of a restaurant and they've got it on their hand or they've coughed on a table and there's a bit of rain, if anything, it might mean that if someone then puts their hand on top of that table, the rain is helping the virus stick to their hand. So I highly doubt that the rain's going to affect it. Just going down the list now on Q&A. We have here, very informative, but is it really necessary to use a mask? What are the measures that companies can provide in office to make safe? Again, when it comes to the mask, it really depends on the type of mask, the user, the environment they're in. So going from the advice from the World Health Organization, they're indeed saying that it's not indeed necessary. But again, in some medical fields, they're definitely recommending it. In an office, again, we're going to have to wrap it up before the feed cuts off, but I'll keep going. Wash hands with soap and dry them. You will find that, particularly in an office environment, is going to be your best method of control. It's easy to implement. You can do it straight away. As an employee, can I take temperature of employees on arrival at work? I'm going to have a think about that one, actually. And it would be good if you could email me afterwards, because, yeah, that one, I'm just, depending on your state, I don't know if you're unionised or if you're under an EBA agreement or if any of these kind of things impact it, then, we could definitely have a discussion about that by email. And then, again, a colleague, JD, is just saying flu season is not dependent on the rain. And yeah, so we're probably not going to see any of that kind of stuff impact the coronavirus either. So we're going to have to wrap it up now to make it for the 1 hour cutoff. But I'd just like to say thank you to everyone for participating. Thank you, everyone, for participating. Sorry, I'm just getting a few messages on the side here. And feel free to get in touch via info@anitechconsulting.com.au, and we can definitely carry on this discussion. But yep, that's it. So everyone, on this very somber note, please have a good weekend and take care.